The Autism Research Institute relies on the generosity of donors like you to make this webcast possible. If you enjoy this presentation, please consider making a donation. Thank you.
Now, before we get started, I'll introduce our speaker. Amanda Tammy holds a master's degree in counseling psychology and has completed a recertification program in the ABA. In addition to being a board-certified behavior analyst, Amanda is a licensed professional counselor. She has experience working with both children and adults, including those who have autism spectrum disorders and other pervasive developmental disorders, ADHD, ADD, anxiety issues, and trauma, both as a BCBA and as a counselor. She has additional specialized training as counselor in EMDR therapy and its applications for children.
Thank you, Denise. Hi, everyone. Thanks for having me today. I look forward to your questions. I'm going to get started with, like Denise said, a brief presentation. I'm just going to cover some of the challenges that I've been getting asked about, a lot of the concerns that parents are having or that teachers are having about what back to school is going to look like. And then we'll have lots of time for all of your more specific questions or the things that I don't specifically cover. Keep in mind that there's a lot that we don't know yet. There's a lot that we're also trying to figure out in our families, the school districts, the states. There's still a lot of unknowns. There's still a lot of things that we have to just wait and see what happens. So what I am going to share today is by no means exhaustive, but rather a starting point. And I will try to answer all of your questions as best I can. Please know that this webinar is for information purposes only. I can't offer any clinical case-specific advice during the webinar or through email afterward. So consult your healthcare provider or contact the Johnson Center to schedule an appointment for any case-specific medical or clinical questions that you might have. So some of the challenges that lots of people are talking about, that I'm getting asked about a lot, are things like, how do we make learning environments safe? How do we help kids get into new routines and learn about possibly hybrid learning models and things like face masks? How am I going to get my child to wear a face mask all day? So let's talk about some of those things first. So first of all, there's the issue of online versus classroom learning. Sometimes some districts and states are offering hybrid models as well. Some families are considering homeschooling or learning pods. And you as a family can't make plans until you know what the options are. Some of those states and districts are still trying to figure that out. I know here in Austin, Texas, is that kids will go back for the first 3 weeks, or kids will do online learning for the first 3 weeks and then have the option to go to in-person classes. But now there's talk about delaying the start of school, which would be 2 weeks from now. So things are still up in the air, even as we get closer to that school start date. In addition, even if you do know what the options are for your child, you might still be trying to figure out what's best. And hybrid systems of instruction, which can make creating a routine especially difficult. And we know that routines are so important for so many kids with ASD. So even if you're not looking at a hybrid system, you're probably looking at brand new schedules, new routines, new requirements, new systems of learning. So there's so much newness in all of this that is causing a lot of stress, and it's causing big questions for so many people. And then, of course, the face masks, sensory issues, breathing issues, the newness, the inability to understand why or why I need to wear this face mask. And so much is still unknown. What are the schools going to do if my child with ASD refuses to wear a mask? for the most part, the answer is we don't know. How are schools going to make sure that kids wear them properly, or don't use them as toys, or don't share them? Again, the answer, we don't know. Can my child go to school if she refuses to wear her face mask? We don't know. There's so much that we don't know, and so much that is being determined at a local level, being decided on at a local level, that there just is no answer. So let's talk very briefly about some things that you can do to prepare to make the transition as easy as possible. Even as we're still waiting for more information and figuring out what the options are, here are some things that you can start now as you wait for more information. So first of all, we need to start preparing now. Even if you don't know yet what your child's school is going to look like, or whether they'll be going to school, doing it online, start talking now with your child about the possibilities and what they might expect. You know, so many parents say, well, I don't even want to talk about it until I know what to do because I don't want to stress them out, or I don't want to tell them one thing and then that's not what happens. Then we have to change the plan and start all over again. But I would highly, highly encourage you to start talking about what school is going to be like now, if you haven't already, even if so many things are still up in the air, even if you haven't decided yet what options are available, or what option you are going to choose for your student. Talk about what the options are with your student. Talk about what you're thinking. This is what we know right now. So far, this is what your school has told us. So far, this is what our plan is. This might change. There's a lot of things that we don't know yet, so this might change. This is what we're thinking right now. And then revise as you get more information. You know, go back to your kids and say, we got some more information and now our plan has changed a little bit. Here's what we're thinking now. And it's much better to give your child time to prepare by talking to them about the possibilities, even if you don't know that that's what's going to happen, rather than, you know, you find out for sure what's going to happen only a few days before school starts, and then you're scrambling to get into a routine. Your child feels like this big changes came out of nowhere, and they're kind of, you know, feeling in shock and overwhelmed by all these huge changes. It's much better if we can plan in advance, and help our kids plan and be thinking about it in advance. Whenever possible, explain the whys behind all these changes. Explain why school is now on the computer instead of a building that they go to. Explain why they have to wear a face mask. For kids who are more limited in their verbal abilities or what they can understand, don't skip this step. Still give them the explanation, because you don't know how much they might still be able to take in. And understanding the why, understanding how the pieces fit together, can do so much to decrease the anxiety, can do so much to give someone more motivation to do this thing that is hard or that's uncomfortable, if they understand why they're having to do it. If face masks are difficult, so again, face masks are such an issue for so many kids with autism, and we just don't know what's going to happen when those kids go to school. If, you know, they're going to not be permitted to enter the school building without mask, or what's going to happen. We just don't know. So if face masks are an issue, I would encourage you, if you haven't already, you know, I know that we're 5 months into this pandemic and you may already have tried all of these face mask related strategies with your kids with autism, but try lots of different types of face masks and lots of different textures. There are even those clear face shields now that don't have to actually touch this part of the face, but they have a little band that goes around the forehead and then a clear face mask. So maybe that's a better, a more tolerable option for your child. But if you're trying to get your child to wear a mask, and this is true even for kids without autism, it's hard to wear a mask all day long. So start small and gradually work on increasing how much time your child will wear their mask. Gradually increase or gradually work from wearing a mask, just around their ears to actually getting it up over their mouth and nose as it's supposed to be worn. So start small, start with whatever you can get your child to do and gradually work up from there, using reinforcement and those behavioral shaping principles if you're familiar with those. Encourage airplane arms to practice social distancing. So, if you are with other kids, hold out your arms, and you can't get closer to other kids than your arm's length. And that's an easy way for kids to understand social distancing and how far they're supposed to stay away. And then teach the environmental cues that would indicate that the child needs to be wearing a mask or using social distancing. So teach your kids, for example, if you use your airplane arms and you're close enough to touch someone, then you need to have your mask on, for example. Maybe it's if you look around and you see any other person in the same room as you, you need to wear your mask. If you are with mom, dad, or brother, you can take your mask off. You don't have to wear your mask at home. So if you look around and you see that you're at home, you don't have to wear your mask. What are those environmental cues? What are the SDs or discriminative stimuli that would indicate to a child that this is the time that I should be wearing my mask, or this is the time that I should be using my airplane arms to make sure I'm staying away from other people? Parents and teachers can both use social stories to talk about the new procedures. It's great if you have some information in advance and can write a social story in advance for preparation purposes. But again, you're going to do the best you can. If you don't have the information until the day before school starts, you can start working on a social story, right? Do as much as you can in advance, and be preparing in advance. Use visual cues wherever you can to be posting lots of signs about hand washing. For kids who are going to school, teach them to look for signs about hand washing, teach them to be looking for hand sanitizer bottles, stuff like that. Again, the visual cues that would indicate needing to wear face masks. So what do those signs say? Visual cues about social distancing, the schedules. If you can make a routine to stay with, whether especially if you're doing online school or homeschooling, put that schedule on the wall, make that a visual schedule. If it's maybe you're doing a hybrid model and some days the child will go to school and some days they'll stay home, you can make a calendar to show with little pictures to say which days are in school and which days are going to be at home. And you would have to have a separate routine for days in school and days at home. Also, be sure that you're pointing out all of the things that are staying the same. What does this child already know related to school? And look, that's still there. You're still going to be riding that same school bus to school. That's not different. That's you know that school bus. You know that school bus, and it's going to be okay. Look for those things that are the same. You are still going to be able to eat your same lunch. We're not going to make any changes to your lunch. You get the same food that you like. You don't have to worry about your food changing. We know that this is what you like, and that can stay the same. Maybe the teacher would be the same if they have a special ed teacher who is going to be their same teacher this year. You know that person. You know what to do. You know what to expect with that person, and it's okay. Things are not everything is new. Look for those things that are familiar and safe. Ask the teacher in advance for any changes to the classroom or the school building. If your child will be going to in-person school, ask the teachers in advance to provide pictures and information about what those changes will be. You know, there might be far fewer kids in the classroom. The desks might be really far apart. When standing in line, there might be little placeholders on the floor to tell kids where to stand. So as much as you can, get those pictures in advance and be talking about those, what's going to be different with the child. And just know that for so many kids, autism or not, the transition back to school is going to be difficult. And you know, the end of summer, the going back to school anytime, for so many kids, it's just a dreadful time. It just is miserable. It's so sad. It's the end of summer. It's back to school. It's a hard time. And now we're in a time when kids haven't been in school for even longer, for several months, many months longer than a typical summer break. And in addition, many have been home with mom and dad. You know, they're home with their favorite people. They're home with their family. Going back to school is going to be really hard for some kids. Expect that transition to be difficult, and that is okay. If it's a difficult transition, it's okay. And most teachers are expecting that also. Teachers know that this transition is going to be really hard. Teachers know that and they expect it. So if you're really worried about it, I would encourage you to reach out to your child's teacher, you know, let them know, I'm worried about this. I think the transition is going to be difficult. How can we work together to make this as smooth as possible? But give yourself a break. It's going to be hard. It's going to be difficult for the child, and the teachers are ready for that as well. All right, so let's get to some questions. Here's some contact information and some ways that you can follow the Johnson Center, who I work for, and some that just our contact information. And Denise, I'm ready for questions whenever you are.
All right, and we've got quite a few. And anybody who's on the line, be sure to type your questions into the question section, and she can answer as many as possible. This is a good one. It's the first one that popped up for me. This is a parent of a person on the spectrum who is starting kindergarten and has not gone to school before. So I'm curious if you were working with a client like that, would there be anything you would do different than you would in any typical year, or might that be an advantage since that child doesn't know anything different? Maybe you could speak to that a little bit.
Yeah, it certainly could be an advantage if the child has never been to school before. They don't know what is different. They don't know that things are strange now, or that it's not a different transition than, you know, transitioning to kindergarten regardless. So for some, that may actually be an advantage. But I don't think I would necessarily do anything differently for that child than I would for, you know, someone who has been in school before. To make the transition easier, do as much preparation in advance as you can. Be proactive about getting the child the information, telling them what it's going to be like, what to expect, what does it look like if you can get pictures. If they're doing online learning, probably going from, pre-kindergarten type of day, type of schedule on a day to school by computer will be a little bit difficult. So if that's what you're choosing, or that's the option that's available to you is online school, maybe you start to have your child do some non-preferred activities on a computer for some part of a day. Maybe you start having them do some non-preferred pre-academic type activities for part of a day, just in preparation for, you're going to school, and it's not, all day is not play anymore. We have to do some learning. We have to do some things that might not be so fun, and you can do it. So let's practice. Let's try it now.
Okay, this next question, and I know we had a lot of discussion about masks. So this is about masks. One person wrote in there in Toronto, and they are allowing students who have special education plans to not wear masks.
Okay.
So I know that that's something that school districts are debating in different areas, and that has been one of the things that are discussed. Another teacher, and you touched on this a little, but she was asking about strategies that she could use in the classroom to support a student. And I know you talked about stretching time, but obviously teachers, if a student comes in and they haven't got tolerance yet, is there anything that a teacher might do in the classroom that might be different, or some sort of reinforcement system, different strategies that they might use to encourage it? Oh, Amanda, I think I lost you. Hold on one second. Are you there?
I'm here. Can you hear me?
I lost you for just a second. Yeah. So did you hear what I was asking? It was a teacher asking for effective strategies in the classroom for encouraging masks.
Yes, I heard. Yes, I got the question. So first, depending on the layout of the classroom and exactly what kind of activities are going on, there may be times that students don't have to wear their masks. There may be times that there's enough distance that they can be apart from each other. And so, excuse me, I would encourage teachers to be teaching their students when they do need to wear a mask. So it's not, doesn't, maybe, again, depending on the school, maybe it doesn't have to be all day. Maybe there are times that they can take it off. And so if you have a student who doesn't have the tolerance to wear the mask at all, let alone for long periods, start with just those shortened periods. Start with those shorter time frames of when it really is essential, because you're in a group with other kids. Maybe, again, depending on the setup and what exactly is happening, maybe there are options for, okay, if you don't want to wear the mask, that's okay. You're still going to do this activity with us, but you have to give us some space. You have to sit a little bit farther away, and that's okay. You're still part of the group, but it's not safe for you to be close to us because you don't have your mask on. And so, you're still participating, you're still with us, and to be safe, you're going to do the activity right here. You're going to do the activity a little bit farther away from the group. Again, it's so important to try lots of different types and textures of masks. Maybe you find one with a favorite character on it and they're willing to wear it. Maybe not. Maybe there just is not a mask that this child is willing to wear, but possibly a face shield. Look for all of the possible options and all of the different types and textures, and see if there's something that works a little bit better for that student, and then use reinforcement to try to get them wearing whatever they're willing to wear for increasingly longer periods of time. I recently saw, and I've never tried this, so I can't speak to whether or not it's effective, but I recently saw where someone had suggested, I think it was in a Facebook group, that you have the child, you set the requirement that while a child is having screen time or is using their iPad or playing games on the iPad or whatever kind of screen much, they really want that, so they may be willing to wear the mask, and it's a way for them to get used to it. Something like that might be something to consider, that during highly preferred activities or times of low demand and lots of reinforcement, maybe that's when we require wearing masks. And if they don't want to wear a mask during screen time, then maybe they don't. If they say no, I don't want to, I'm not going to do that, then they're not doing screen time. Win-win, maybe.
That's a great idea. Making them do it during screen time, or not making them, but encouraging it then. All right. So the next question, we talked a little bit about transition from kindergarten, and this is a parent who is facing transition to middle school during this time. So they're going to be transitioning to middle school, possibly completely online, where the student's teacher will be changing constantly throughout the day. So what I would imagine that this transition is something we all have to work with our kids on the spectrum. But if you were doing it during this time, do you have any suggestions about how that might be easier to explain, or just some typical practices you've used in the past for the regular transition?
So yeah, it's so much harder with all of the unknowns and with this switch to online learning and what's that going to be like. It really is a difficult time for parents. So let me make sure I understand the scenario correctly. So the child is transitioning into middle school, and it will be completely online, but it will be just like regular middle school or in-person middle school, in which he'll be switching classes, or she'll be switching classes and have different teachers.
Right.
Okay, so that's a lot of confusion. That's a lot of moving parts and a lot of possibly a lot of chaos. So I would try to help the student organize the day as much as possible, understand the day as much as possible. So work on a detailed schedule with the time that school starts, the time that each class period goes from this time till this time. This first class is English, and your English teacher is this person. Here's what you need for this class. Next class is this block of time. Here's your teacher. Here's what you need for this class. And so writing it all out, making it visual if possible, and then organizing the supplies or the, what the student would need for those classes, along with that visual type of schedule that you're going to make.
This next question is about students who have a difficult time sitting in front of a screen all day, or even for an hour. So what are some strategies you've seen, and what is the parent's role in that? So how can the parents support that effectively, particularly, I guess, parents who are trying to work or do other things? What's the rule here?
So this is a really hard one, because a computer by nature is full of distractions. And so to ask a child who already does not have a developed frontal lobe that can inhibit them from going to one of those distractions is really hard. And it's my opinion that by asking a child to sit in front of a computer all day to learn is, in a lot of instances at least, asking a child to do something that they're not capable of doing. The distractions are there, and kids just are not able to not attune to those distractions. So this is a really hard question. This is certainly something that so many parents are going to be wrestling with. So what I can say, what I can suggest is make sure that you're building in lots of opportunities for breaks. You're giving lots of time away from the computer, lots of body-based movement away from the computer. When possible, it's great if it's an option for parents to, if parents are working from home, to be working alongside of their kids. So we're both, sitting here at our own computers doing what we need to do. And as you're sitting there next to your child, yes, you're able to redirect them back to the screen, back to what they're supposed to be doing, but also it's an opportunity for you to teach your kids, more of those attending skills, and teach your kids more of the how to avoid distractions, or how to set up their own work environment in a way to minimize distractions. So co-working, and then say, oh, I noticed that you have two screens or two windows open. Which one are you paying attention to right now? Which one's most important right now? Or I noticed that you're looking back and forth. Seems like the one screen might be a little bit of a distraction. So, and then problem solve together when possible, and when it's within the child's capabilities, problem solve, what how can you get back on track? How can you get back up to the lesson that you're supposed to be working on? And again, if your child is capable of something like this, talk about how do you want me to help you stay on track? How do you want me to let you know when I see that, when it looks like you're distracted? Or, how do you want me to be of help in this situation? But there is no short answer. There is no short solution to this. This is a long-term game we're talking about. So, like I said, there are so many distractions built into a computer. The computer is inherently distracting, and there is no there's no short solution to that. There are those apps or those programs that you can use to monitor what your kids are doing on the computer, that would allow you to see how much time they're spending on their classwork or on other stuff. But that alone would not teach a child how to stay on task, how to stay on whatever it is that they're supposed to be doing. So if that is the goal, and that's what you're needing for your child to be able to do, parents need to be able to take kind of a mentorship role and say, sit down next to the kids and say, here's what I'm seeing, how can I help you? How do you know when you're distracted? How can we help you stay on track? So this is a long-term goal that we would be working toward. There is no quick and easy solution to paying attention to online school, unfortunately.
All right. Well, this next question, actually, this is something from a teacher that might be really helpful to hear. This person writes, knowing that there are often some students on the spectrum yet unidentified, would it be a good idea to include social stories, simple songs, and visuals to all gen ed classes? For example, in grades K to 1 anyway. Usually these grades benefit from extra visuals anyway. We have a hybrid model in the works where the counselor and myself, a social worker, will be pushing into those grades to do 30 to 35 minute lesson segments. We'll be sure to include brief songs and media-based stories for hand washing, mask wearing, and the why, as I feel that that will help them understand the reason they're more likely to cooperate. So that's a teacher writing in, sharing kind of what they're working on in their district.
Oh,
So
great.
some helpful insight. Yeah, the songs and those kinds of things would be really fun for kids, I'm sure.
Yeah,
And
that's a great idea. And
yeah,
I agree. Doing those for a general ed class, autism or not, those strategies are going to help any kid.
yeah, that's great. Thanks for sharing that. The next one, this one I think you'll appreciate. This person works with kids who have a history of refusal to go to school pre-COVID. She's concerned that the current situation will actually reinforce that avoidance in the long term. She's concerned about how once students re-enter the classroom, will there be worsening anxiety and school refusal? Do you have any thoughts about how people might sort of pre-address this? And I may be putting you on the spot there, but thinking ahead, or would your strategies be talking about it in the same way that you would even during times when we're not in a pandemic?
Yes. So I think that it is certainly a possibility that our that life right now would further reinforce school avoidance. So not a guarantee, but there are so many factors out there right now that could very well reinforce that kind of school avoidance. You know, if school was already an unpleasant place, now it might be even more unpleasant because of all of the new changes. If school was a scary place, if the idea of going to school was scary, it might be even more so now. Now there's a virus that might kill me. I can't go to a school. If you know, school was a place of anxiety, they've been out of school now for 5 months, and going back to school, and if they don't go back to school, like if they're going to online learning or something like that, that's an even longer time to be away from that stimulus that causes so much anxiety. And we know that when it comes to anxiety, the more we avoid that thing that's causing the anxiety, the more the anxiety tends to grow. So yeah, I mean, it's a real concern. It really is. So yes, your concern is absolutely valid. And right now, at this time in our country, in our lives, in the world, the situation that we're dealing with is coronavirus, is COVID-19, and that's not going to change. So if going back to in-person school is not an option, if you're doing online learning either by your choice or that's what option is available to you, that is okay. You know, if this is what you need to do right now, this is what you need to do right now. We'll deal with the school refusal when it's time to go back in the future. We need to do what we need to do to keep everyone to keep our kids safe and make the best decisions for us right now. And if the best decision for your child right now is to not go back to school, even if they have a history of school refusal and you're worried that this is going to make it even harder, do what you need to do right now. Make the decision that's right for right now. Long term and more broadly speaking about school refusal, we would want to be looking at why is school, so why do they refuse to go to school? What is their experience at school? And how can you, as a parent or as a teacher, create an environment that feels safe, that feels like they can go to school, they can handle whatever challenges come up, and it's going to be okay. So the school refusal is really a much bigger issue to be addressed. And maybe if you're doing online learning and not going back to school this year or in the near future, the first couple months at least, maybe it's an opportunity to explore that, to explore, you know, why this school refusal is there, what would make it feel safer, what would, and when I say safe, I don't necessarily mean that there's, well, right now there is a threat to all of our lives with COVID, but I don't mean that at school there is some threat that the child's life is in danger. Absolutely not. I'm talking about psychological safety and what at school makes that student feel in some way unsafe, feel like they can't handle what's happening, feel like they're going to fail. What is it that is creating this sense of lack of safety?
So picking up on that, one person here is asking about fear of the virus. So she has a child who is afraid of COVID, and that's not an irrational fear. So as teachers and support people and parents, I don't think there's an easy answer to this, but are there strategies that we can use to help our loved ones cope with living with that stress of awareness of the virus and being constantly reminded by masks and face shields and all these different things?
So I would suggest talking about those reminders, those constant bombardments of information about the virus, like everyone wearing a mask or like needing to stay apart from other people. Talk about those as safety. Talk about those in terms of, this is what we do to stay safe. We can wear a mask and we'll be safer. We can wash our hands and we'll be safer. These are all things that you can control. These are things that are in your power. You are empowered to stay healthy, to not get this disease by doing these things. Maybe it's not 100%, but these are the things that we can control. These are the things that we have the power to do to keep ourselves safe. So we're not helpless. We are not helpless against the disease. There are things we can do, and we're going to do those things. So this is what we're going to do. And so that's part of why the explanation of why is so important, especially for a kid who is really anxious about the disease, to understand why we have to wear face masks, to understand why we're washing our hands, because it can be empowering. It can be empowering to know, well, I'm okay because I'm keeping my hands away from my face, or I'm okay because I'm washing my hands a lot. So that's empowering. And then I would, so if despite the information and despite that, framing what you're doing as a way to stay safe, and these are the things that are within our control, we're not helpless. If the anxiety still continues, then we need to add in some anxiety management strategies just to address anxiety in general. So things like mindfulness exercises or grounding or using the 5 senses, depending on the age of the child. Things like, positive self-talk and noticing relaxation in our bodies. How does our body feel when it's relaxed? Having a bath or a massage or something, some really relaxing activity, and then noticing in the body what that feels like. That's again, it depends on the age and the abilities of the child, but they also might be able to do exercises like noticing breath, or practicing taking 5 breaths or I'm sorry, taking deep breaths for 1 minute or something like that, or 5 times, take a deep breath and let it go 5 times. So incorporating just anxiety management type activities, not necessarily specific to the virus or specific to the child's fears, but just decreasing that level of anxiety overall.
This next one is one I've actually heard from quite a few parents. They have a loved one who really is uncomfortable with eyes and faces on screen. It makes their child really uncomfortable, and that's something hard to tolerate. And so she's wondering about how to help support through online learning.
Good. That's a great point and a great question. So definitely talk to the teacher as soon as possible about this, about the fear, the concern, the behaviors that come up when a student is when they see the eyes or the face on the screen. Even if a child doesn't have really extreme challenging behaviors when they encounter this kind of a stimulus, if that's causes fear for them, they're not going to be able to learn. So talk to the teacher as soon as possible. Maybe it's an option for during one-on-one instruction for the teacher to I don't know. Can people see my video, Denise?
Yes.
Okay. So
Yeah.
maybe it's an option for teachers during one-on-one instruction to put their screen more like that, so that the video is still there. They are still able to hear and interact with the student, but without the face on the camera. It would certainly be a lot more difficult during group instruction when lots of kids are on the screen. So we may have to find an alternative for the student rather than the teacher. And so maybe the student, when it's group instruction, maybe he doesn't have to, maybe he can do audio only. He doesn't have to be watching the screen with the other students. Maybe there's a way to, I'm not gonna use the right technology words, but maybe a different format of the video platform where the icons or the boxes, I'm so tech not savvy, the boxes with everyone's videos can be all along one side that can be covered. And then they can still see, the child could still see the screen share without having to see all of the other faces. Certainly there are ways to work around it, I think, but you need to have the teacher on board and have the teacher understanding what a problem this is, not just in terms of behavior, but for the child's learning. It's incredibly important for the child's learning that he not have to look at a face on a screen. Also, I'm wondering if the teacher or whoever was on the other side of that camera were to wear a face mask or sunglasses or something, to help to cover their face while they're talking with that student by video. I wonder if something like that would help. I'm sure it would depend on the child, but maybe it's something to consider.
All right. And a teacher wrote in and said one thing that they had done. One teacher said she did turn her camera off. She ended up just doing audio, but she had her name displayed. So, so in Zoom, how your name will show.
Mm-hmm.
And the student liked that. And another teacher said that they had their students sit at an angle. So he didn't have to see all the faces, but he could.
That's a great idea.
So kind of sat off screen. So there's some ideas from a couple other teachers out there too.
Yeah.
The next question is about caregivers. So caregivers are in the middle of this. You just talked about parents, like how we should try to work alongside. I know you've talked about self-care in the past, and if you had just have some thoughts about parents making sure, and teachers too, that they're kind of giving themselves a break, as you said, and other things that we might do just to sneak in little self-care moments.
This is a really hard time for everyone, so expect that it's going to be a hard transition. Expect the teachers and parents. Can you hear me?
Yeah, we can hear you.
It's going to be a really hard time for parents, for teachers. Back to school is always hard, but especially now, it's going to be hard. And it's absolutely essential that you find ways to take care of yourself, that you find ways to give yourself a break. Self-care does not have to be, a big thing. It doesn't have to be an all-day event, and it shouldn't be. Your goal is to find ways to incorporate self-care into your everyday. You don't need to go on a weekend yoga retreat, excuse me, to give yourself some self-care. Taking 5 minutes of stretching between meetings at work is self-care. Walking away when your child is having a huge meltdown and you are on the verge of getting so overwhelmed yourself, walking away is self-care. And taking care of yourself, finding that time for self-care to reset your own emotional state is obviously it's needed for your own health, your own sanity, but it's also needed for that of your children or your students. If you are stressed, your kids are stressed. If you are not able to think clearly to solve a problem, they're not either. So your emotional state really does impact your kids. So it's self-care is the most important thing you can do right now, is to take care of you, because your kids pick up on whatever you're feeling. Your kids feel whatever you're feeling. Their nervous systems are tied to yours.
So this question's from a teacher. This may be a tricky one to handle because this may come down to school rules, but this is someone who works with kids who have self-injurious behaviors. So she's wondering about, in a time of social distancing, how do you support a student? Obviously, the goal is always to touch the students as little as possible, but if you are trying to keep somebody safe, do you have thoughts about that, or how a clinic might handle something like that?
So this is where I think communication with parents is really important. So before, in an ideal world, and I know that we don't always have this ability, but excuse me, in an ideal world, before any self-injurious behavior were ever to happen at school or at a clinic or wherever, while parents, once school has started and parents are not there, school staff or clinic staff would talk to parents about these behaviors. This is what we would normally do before COVID. This is how we would have kept the student safe. This is how we would have responded to this type of behavior. Now that, we're needing to social distance, I, as the staff person, will be wearing my mask, but if I need to, I need to get close to your student. I need to get close to your child to keep him or her safe. And are you okay with that? As far as if parents say no, that's not okay. That's dangerous. You're exposing my child to a virus. Then maybe that's a decision that then you need to take to your school administrators and say, I don't know what to do with this. How do we handle something like this? From my perspective, the safety of the student always needs to be top priority. So if we are, having to get close to a student to keep him or her safe because of aggressive or self-injurious behaviors, that's what I'm going to encourage people to do. That's what I'm going to, recommend to parents and to my staff. We're going to be wearing our masks. We're going to do what we can. We'll, as much as we can, keep our face turned away from this person. But if they're causing harm to themselves, we need to get close enough to intervene. And the school district may have a different policy than that. And of course, you'll have to follow that of your school district or your state. But it's my opinion that the safety of the child always has to be top priority. And that may mean that you have to touch the child or get very close to the child.
All right.
Related, I have a little boy who's in preschool, and at his preschool, they're all young kids, and they're talking about whether or not they're gonna allow teachers to offer hugs if a child is crying or is in distress, or is the teacher allowed to give a hug or to get close to that student to offer comfort. I don't know. We don't know the answer. It's, so much is up in the air, and so much is changing day by day, and so much is changing from 6 months ago, the way we would have handled the situation 6 months ago.
All right, I've got a couple more questions I'm hoping we can do. This one's really good. This is a teacher who will be interacting with students she hasn't worked with before. And so she's wondering if you have any ideas. I don't know if you've been doing a lot of therapy online or not this summer, but about building rapport with kids you haven't met face to face and just doing it on video.
Mm-hmm. Yeah, that is a good question. And so what I can say, and I don't know how helpful have all been one-on-one rather than a whole classroom full of kids at the same time. But when I'm, and it's funny because when all of the shutdowns and the social distancing, and when I switched to telehealth for the spring and the summer, it felt like I was restarting and going back to building rapport, building the relationship, even with kids who I had been working with for years, because the format just feels so different. So I would suggest spending lots of time doing non-academic activities to start, just singing together, playing games together, everyone drawing together, or I think there's a way to play Uno online that I've done it with some kids. So just playing games or doing the ABC game where you have to say something that starts with A, and then the next person says something that starts with B, A and B, and then A, B, and C. Those kinds of games that have no academic, something that you can play as a group, but are not academic, or not difficult, don't place any demands on the kids other than being present and being in front of their computer. Always start with the rapport building and relationship building before introducing any sort of academic